Welcome, everybody. We're just going to give everybody a couple of minutes to hop on. Thank you so much for your patience. We were just having a few technical difficulties getting started today. So I think in the interest of time, we're going to go ahead and get started today. I would like to start off by thanking everybody for attending our session. My name is Alexa Thompson. I am a third-year PhD candidate in the Department of Laboratory Medicine and Pathology, a WICRI graduate student, and I'm also chair of the WICRI Trainee Advisory Committee. I will be one of your hosts, and I would like to welcome you to today's WICRI learning session, Creating Research That Matters Through Stakeholder Engagement, Development and Use of Alberta Child Health Research Priorities. We have the pleasure of welcoming our two guest speakers today, Andrea Eaton and Dr. Sarah Elliott. And before we get started, we just wanted to share the University of Alberta's land acknowledgement. So the University of Alberta acknowledges that we are located on Treaty 6 territory and respects the histories, languages, and cultures of First Nations, Métis, Inuit, and all First Peoples of Canada, whose presence continues to enrich our vibrant community. And we also would like to thank our WICRI funders, the Dollar Children's Hospital Foundation and the Alberta Women's Health Foundation, for making this session possible. The session is scheduled to last about an hour, and then we'll have lots of time at the end for questions. We'll also be recording the session, so if you do not wish to be seen, make sure to have your cameras off. And we do also ask that everybody remain muted during the course of the presentation. And with that, I will hand it over to Andrea and Sarah.
Great, thank you. We'll just wait for Andrea to share her screen.
Be coming up.
Perfect. Now I just need access. Okay, thanks everyone for being here. It's really nice to see familiar names in the Zoom black boxes down the side. As mentioned, my name is Sarah Elliott, and I'm the Assistant Director for the Alberta Research Centre for Health Evidence that's located in the Department of Pediatrics here at the University of Alberta. In this role, I support a number of knowledge synthesis and primary health research in child health. And the main focus is really on stakeholder engagement and knowledge translation. I work really closely with Dr. Lisa Hartling, a professor in the Department of Pediatrics, and Dr. Shannon Scott, a professor in the Faculty of Nursing, to support their joint research program, which looks at developing knowledge synthesis and knowledge translation products to improve child health outcomes. The work I'm going to be presenting today is actually based off a successful pilot study we did in 2017. So it's really great to be here today to present the full-scale project, as well as our findings, and talk about how the research we've done can inform the research that you and funders should hopefully be working towards in the future. But before I go into my research project, I'll hand it over to Andrea to introduce herself.
Thanks, Sarah. So like Sarah said, my name is Andrea. I'm a graduate student here in the Department of Pediatrics at the U of A. My supervisors are Drs. Jeff Ball and Michelle Dyson. Personally, I've always had an interest in community health, preventative care, primary care. I work as a registered nurse outside of grad studies. So when there was this opportunity a few years back to pursue graduate studies in the community research area, it really felt like a good fit for me. Along with grad studies, like I said, I work as a clinical research nurse. It's also with the PEAC research team out of the Department of Pediatrics here at the U of A. And there I've definitely seen firsthand how apparent it is when the research really is meaningful and relevant for patients and families. So being a part of a priority setting project where we could promote that kind of research was really, really fascinating to me.
Thanks, Andrea. So for today's session, I'm going to run through the objectives of this learning session. Andrea will then present on the priority setting project that she led. I'll then discuss the priority setting that I recently led. We'll then go through sort of comparing and contrasting the different approaches, as well as the different findings or similarities in the priorities. Then we'll also talk about how we think these studies can guide further research and priority funding calls. I think we're aiming for about 45 minutes of us presenting and talking, but we've left a huge chunk of time to hopefully have a discussion with everyone and hear about their thoughts, their comments, questions, and how they think they can use the priorities that we've found to engage stakeholders and inform their research directives. So this wouldn't be a lunch and learn or a learning session without any of learning objectives to report. So hopefully by the end of today's session, you'll understand more about the current child health priority research areas in Alberta. You'll learn about the different stakeholder engagement and priority setting processes that can be undertaken, and learn how to utilize these findings to guide primary and knowledge translation research initiatives in child health. So over to you, Andrea, to present your project.
Perfect, thanks. Alrighty, so like Sarah said, I will sort of present an overview of my priority setting project, and Sarah will talk about the one she led, and then we'll bring them back together. So I'll start with the study you can see here on the slide. I'm really happy to share it with you. It's one that we just completed last October, in October of 2021. So these are the priority topics we found for child and family health research, according to caregivers and healthcare professionals. So one note is, when I say caregivers, I sometimes will say parents instead, and I'm using those two terms to refer to parents or primary caregivers of children under 18 years. And then healthcare professionals, healthcare providers, I will also, unfortunately, I flip-flop between the two. So just a little bit of background of why we took on this priority setting project at the Northeast Community Health Center. It was in the works before I began my grad studies. My supervisor, Dr. Jeff Wall, had been collaborating with some colleagues from Sick Kids in Toronto. And there was this interest in exploring a new site for community-based pediatric research in Edmonton. And then further, there was interest from pediatricians who work at that site. And they also have academic appointments at the university. So they had this interest as well. And together, there was this common goal of establishing and developing research capacity and engagement at a new site in Edmonton. So there was this new site, and there were these researchers who wanted to do some research. And traditionally, what would have happened is the researcher would have walked in and just said, like, this is the research we're going to do. I know it's important. I know it's going to work. Let's do this. But increasingly, researchers are engaging with patients and stakeholders to determine the topics that actually matter the most to them. This goal is patient-oriented research, of course, which focuses on and aligns with topics that are the most important to patients, their families, and healthcare providers. And conducting our study was really a foundational step and part of a longer-term plan to conduct this patient-oriented research that was community-based at a potential site in Edmonton. And then a couple of notes with patient-oriented research, that it's not exclusive to being focused on the patient alone. It could be considered, patient-oriented research or family-oriented research, because it does extend beyond patients and often involves other relevant stakeholders who have a direct impact on the health of children, such as their parents or caregivers. And then it can also, include stakeholders like healthcare providers. So just a little note on the setting that we conducted our research at, which was the Northeast Community Health Center in Edmonton. Very little research has been done here in the past. It's a site with many different clinics within it, and there's 3 there that provide specific pediatric care. We know that context matters. So with this interest in pursuing research at this site, it is important to understand the unique needs and priorities of families accessing health services at this site, just so we can facilitate future research that is, patient-oriented and meeting the needs, interests, and priorities of the community. So with that, we did this priority setting project in order to find out, if we were to do research at this site, what research is the most meaningful and important and relevant for stakeholders there. So our objectives were first to identify the unanswered questions that stakeholders had about child and family health. And then from these questions, number 2 was to generate this top 10 list of priority questions about child and family health. So to do this, we followed a modified James Lind Alliance methodology. I'm going to provide a little bit more detail just because it is the process that both Sarah and I based our studies on. And we both did complete modified James Lind Alliance methodologies, but I will highlight the steps that are in a typical JLA. So this process is an evidence-based priority setting methodology. It's a systematic process that was designed specifically for this reason, to engage stakeholders to work together to generate this top 10 list of research priorities. It centers on engagement of stakeholders as active and integral partners throughout the research process. The process is mixed methods and has sequential surveys and focus groups or workshops. And the end goal really is to ensure that research that comes out focuses on topics that are directly relevant to patients, but then also to increase the awareness of these patient and stakeholder identified priorities amongst researchers and funders. So our study was planned for between 12 and 18 months. We started in July of 2019, and like I said, ended in October of 2021. So it definitely took longer than we anticipated. Part of that was due to COVID, and then part of it was due to stakeholder engagement just requiring more time and relationship building than one can, I guess, plan for going into it. So here you can see the sequential steps of the JLA priority setting process. It is step by step and sequential, and within each step though, there is this flexibility, but typically the main steps of the process would remain unchanged. So here you can see the steps of the priority setting process again. This one ends up being a bit of a busy slide, but it's just as I walk you through the steps of the project and then the results and our engagement throughout. So step 1 was to create this steering group. This group is a group of stakeholders, which included parents, caregivers, and healthcare providers. So when I refer to stakeholders, this is who I'm talking about throughout the project, is parents, caregivers, and healthcare providers. We had 10 stakeholders join us on this steering group, and the first task we did was to create this initial survey, which was used in step number 2 to gather questions. So in step number 2, really, we went out and asked a wider group of stakeholders, what questions do you have about child and family health? What questions do you wish were being answered? What questions do you have about family health? We recruited 100 parents and caregivers and 25 healthcare providers in person for this survey. One note with this one is that halfway through recruitment was when COVID-19 was declared a pandemic. So we were about halfway done, paused recruitment for about 5 months, and then we were able to complete it in the summer of 2020. And so really, although we will never know the real impacts that COVID-19 had on the end priority list, apart from the obvious ones that involve COVID, it is just something to consider that all of the remaining steps in the process were completed during COVID restrictions. So when we completed that survey, we ended up with 1,265 unique submissions, and that was completed, like I said, in person using a REDCap survey. In step number 3, all of the submissions were then organized and summarized. So any similar questions were combined to create this master list of indicative or summary questions, and we ended up with 389 of those. And then in step number 4, we wanted to know which of these questions on this master list were actually considered to be unanswered. So we went through and compared those questions to high quality evidence-based sources, things like Cochrane reviews or systematic reviews, pediatric societies guidelines, things like that, and found that 108 of the questions were considered to be unanswered. Then the questions that were considered unanswered moved forward to this interim priority setting survey. So another 100 parents and caregivers and 25 healthcare providers. They were again recruited in person at the clinic and asked to select the questions that they felt were the most important or the highest priority questions. These survey results were then compiled, and the highest ranked 26 questions moved on to step number 6, which was our virtual final priority setting process or workshop, sorry. This workshop is typically held in person over a half day or a full day, but because that was not possible during restrictions, we moved it to a virtual setting. And here there was discussion and rounds of voting, and then the top 10 list was finalized at this time. And then the last step, of course, is number 7. And I did say our study is complete, but really part of the process is that you stay in step number 7 for quite some time, just as you share your findings as widely as possible in order to really promote the research. And the most important thing to come out of our study is this final top 10 list of priority research topics. So the number 1 ranked question was, what are the best strategies for the prevention of mental health issues in children and families? The questions that were submitted really spanned diverse topics. They included screen time, development, behavior, physical activity, parenting, nutrition, diet. But our final top 10 list really does have a prominent mental health theme. These priorities really can be used to facilitate future research that is patient-oriented and addresses practical and meaningful issues for the stakeholders. So although our project was completed at a specific site, do consider these priorities or others as you do your work as a trainee or as an academic, as another professional. Use the stakeholder identified priorities to guide your work, or you can also reference them to support your work. And so although we've completed this top 10 list, we do know that the real value of the project does lie in the implementation of research that aligns with these priorities. And these will come back up later in the presentation. So if you didn't get a chance to read through them all, that's okay. So our priorities are now being shared with the Northeast Community Health Center, with potential collaborators, the wider community, and hoping to promote more relevant and meaningful research. And like I said, this was really a foundational step as a part of a longer term plan. So our research helped to develop local engagement and capacity for more research at this site. And we do look forward to seeing more research come out of these priority topics. And then one of the priority topics was used. It was actually the second project in my thesis. And so that was related to priority question number 3 on the impacts of COVID-19 related closures on children's physical and mental health. So with further stakeholder engagement, this broad question was narrowed down in scope to create a more focused review question. And then that review that we are nearly completed is a review on the qualitative evidence on the impacts of COVID-19 restrictions on physical activity for children and youth. And then just an acknowledgement that our research was funded through the support of the Stollery Children's Hospital Foundation and through WICRI. We used REDCap to collect and manage all of our data, which is hosted and supported by WICRI. And of course, lastly, we would like to acknowledge and thank the stakeholder partners, families and staff at the Northeast Community Health Center for their continued support of our research. So the top 10 questions are listed there. If anyone has any burning questions before Sarah presents, you can either put them in the chat or bring them up now. And we'll also have another couple of question openings coming up. So I will pass it back over to Sarah if there's no questions.
Thanks, Andrea. Can't see any come through, so we'll kind of just chug along. So that was a really nice, I guess, overview and a well-conducted JLA approach. So thanks for sharing that. Now, our project was also funded by WICRI. It was through a WICRI Innovation Grant awarded to Dr. Shannon Scott and Lisa Hartling. And some have said it was a rather ambitious undertaking. Nonetheless, we set out to establish parent and youth priorities in child health across Alberta. So why did we feel this was important? Well, as I mentioned earlier, we did run a small pilot study with a group of Went too quickly. With a bunch of parents in 2017 to understand what their priorities were and whether or not that aligned with the current research agenda we had, and if we wanted to expand on work that was being done, or whether or not their priorities aligned with what was currently available in the literature. And additionally, as I think Andrea mentioned earlier, and set the scene quite nicely, we just want to reiterate that while there is a growing body of literature that supports the active involvement of stakeholders in the prioritization and dissemination of evidence-based healthcare information, the perspectives of parents and specifically youth are rarely acknowledged in child health research. So we really wanted to engage parents and youth to help identify and develop priority list of research topics or questions that were most relevant and important to youth and their families. We hope that this would have significant impact on future research directions in child health and also give families and youth a voice that's not often heard in this research space. So a large proponent of successful research with parents and youth is the ability to engage with them from the outset. And it helps to understand how best research can be developed, executed, and disseminated in a way that's engaging and it meets their needs. Now, we're incredibly lucky that we have our own pediatric parent advisory group to work with, or the PPAC, as we like to call it. The PPAC was developed in 2016 as a joint initiative between Dr. Hartling and Dr. Scott. And the PPAC provides advice, guidance, and knowledge from a parent's perspective to inform and improve our research activities and initiatives in child health across Alberta. And for this particular project, they worked with us as collaborators on the grant and the project. We were also lucky enough to work or partner with 2 Edmonton youth advisory groups and an advisory group from the Alberta Children's Hospital, as well as with Alberta Health Services, Maternal Newborn Child and Youth Strategic Clinical Network. 2 of their patient and family advisory councils and committees helped us develop and set the agenda for our priority setting process. And it was great. We had this wonderful modified JLA approach to start and move forward with, and then the pandemic hit. And in the words of Ross from Friends, we had to pivot, and we had to pivot very quickly. We re-engaged with our stakeholders to understand how we could move this work forward, knowing that in-person recruitment processes and focus groups could no longer happen. So that resulted in a 5-step process that was completely run online between February and June of 2020. First, we generated an extensive list of child health research topics for prioritization. This original list incorporated priority topics that were set by Alberta Health, as well as the MINCI SCN strategic roadmap, as well as we had input from our clinical co-investigators as to how to refine the topics. We then took this list to our parent advisory group, who helped us rename some of the topics or categories and make sure the survey, or the questionnaire, was formatted in a way that was user-friendly. We also took the list to the advisory youth groups, who suggested that we make a few tweaks to the terminology, but also provide examples of what we meant under each category to really help parents and youth understand what we meant by that research topic. So 2 surveys were developed, and they contain the study information letters, the online consent form, a demographic questionnaire, as well as this list of 27 child health topics. These surveys were distributed online through our social media channels, as well as through our stakeholder engagement networks across Alberta. So the questionnaires asked parents and youth to rate the child health topics in order of priority as low, medium, or high. And any topic that was rated as a high priority by over 70% of the participants were retained and moved forward to step 3. So step 3 involved a number of online or Zoom focus groups that were held with interested parents and youth separately to discuss the highly rated topics and to help us understand what exactly about that topic was important. These focus groups were recorded transcribed and thematically analysed to produce representative research questions from those discussions around specific items that were most important to parents and youth. These final questions were then circulated again to parents and youth for them to separately rate each of the topics from most important to least important, as well as to rank their top 10 research questions. So, despite not being able to do in-person recruitment or in-person focus groups, I think we did get a fairly decent uptake from the community. Is my slide moving forward?
There it goes.
There we go. Okay. So we actually had 273 parents and 344 youth across the province participate and rate these topics. We then ended up with 5 topics that were highly relevant for parents. These included behaviour learning and developmental disorders, mental health, food, environment and lifestyle, quality of healthcare, and vaccines. And we ended up with 4 topics which were a high priority to youth. These included brain and nerve health, mental health, quality of healthcare, and vaccines. These topics were then discussed in 4 parent focus groups and 6 youth groups. And that generated 19 research questions for parents and around 25 research questions for youth, which were then ranked by 43 parents and 62 youth to come up with a list of the top 10 research questions or topics that were a priority. And for parents, the top priority topic was, what is the effect of screen time on my child's neurodevelopment? And for youth, it was, what are the early signs of anxiety and depression, and when do I know to seek help? It moves. So here are the top 10 parent-child health research topics. I'm not going to go through them in detail, but as Andrea said, there's, I guess, themes or trends that come out. A lot of the parent priority topics were centered around mental health, as well as how to advocate for their child's health within the healthcare system. And for youth, again, mental health was the predominant theme in a lot of the priority topics, as well as that self-advocacy piece. So I thought it was quite interesting, but Andrea is going to go through a little later on and really compare and contrast the priorities between the groups. Now, it'd be remiss if we didn't actually mention the fact that, yes, we acknowledged that during this process, the world was in a pandemic. While it wasn't initially something we wanted to look at, there was an open category or an other category in the initial survey. And in that, a lot of responses were just pandemic or COVID-19. So we did decide to take those topics to the focus groups and discuss at the end of the other topics, you know, how parents and youth were going, what were some of their main concerns or questions around the pandemic, and where did they think the most important aspects of research needed to be focused on. And this generated about 5 parent questions and 6 youth questions that were also rated and ranked in the final questionnaire. So related to COVID, the 2 parent priority questions were centered around the short and long-term effects of the lack of in-person socialization during the pandemic, and what was the effect of online learning and smaller class sizes on students' attention span, motivation, and academic performance. And for youth, it was similar in terms of they were wanting to know what the implications were around their academic experiences, but also what were the impacts of COVID-19 on youth mental health due to reduced socializing and increased academic stress. You know, we've been, I guess, surveying the literature in this area for 2 years now. And what's been really interesting is to see like some of these research questions are now being answered by the research that's being conducted and produced. So it's nice to know that at the time, the questions around the pandemic that parents and youth had were being answered, whether or not that's shifted now as we've moved through the pandemic. But I thought that was quite an interesting point to note. So in terms of who participated, I've just pulled up a few demographics. This isn't everything we've collected, but I think it highlights just those that did participate. And it was really no surprise to me that the majority identified as white females who were born in Canada and resided in an urban area. However, I think it's really cool to see there was a fairly, well, 33% represented by males in the youth group as well. We had a fairly high percentage of fathers participate, which was really interesting to see, as well as the fact we had representation from different ethnic communities. And while a lot of the participants were centered around Edmonton and Calgary, we did have a fairly broad representation of participants across the province. So we had some participating from up in Fort McMurray, as well as some participating down in Lethbridge and Medicine Hat, which was quite neat to see. So now we have these two top 10 lists of research priorities for parents and youth. What do we do with it all? So we think it's really important to start mapping the evidence in these areas to understand, are there key gaps in the evidence, where they are? Is it related to an evidence gap that can be filled with primary research initiatives, or is it more a knowledge translation gap? So for our two topics that were of priority for parents and youth, we've decided to investigate them further. So we're currently conducting a scoping review on what we know about excessive screen time on children's neurocognitive development. And we've recently undertaken a systematic environmental scan to look at what online resources are available around anxiety for Canadian youth. We also worked quite closely with our stakeholders to create dissemination materials that varied in the approach, and they were targeted for the different end users. We also wanted to make sure like all of the different end users that we were trying to approach could be targeted. So for research organization and grant funders, we created an infographic and disseminated that via email and through our Twitter channels. We also use traditional methods of dissemination, such as conference presentations and learning sessions like this one. And then for parents and youth, we worked with our stakeholders to create some fun social media campaigns and some knowledge translation products to help disseminate this information in slightly different formats that were more relatable and easy to access than some of the more traditional dissemination methods. So huge thank you to Wickery for supporting this project and allowing us to utilize the knowledge and experience of Albertan parents and youth to create these lists of priority topics in child health. I strongly feel that these lists highlight the areas where funding and research should be directed. And it's also good to acknowledge and improve health outcomes and patient experiences that are important to parents and youth across Alberta. So again, we've got time for any questions about the specific processes that we used. We tried to keep it fairly high level because of the time, but any burning questions, feel free to ask them now. If not, we'll kind of move on to looking at our different approaches and what that meant.
Hi, I have a question. Great presentation, by the way. And I was just wondering, how did you get such a large recruitment and sample size with people? Like, was there any type of incentive you used?
Yeah, great question. So incentive-wise, for the initial survey, we had completers could enter into a draw to win an iPad. We kind of knew we needed some sort of rather enticing incentive to support survey completion. We knew that people were getting bombarded with information online, and this was just another survey to complete online. So that definitely helped. We were a little cautious at first as to whether or not that was the right approach with online studies, because we have seen examples of where I think they're little robots or something online happens where it's not actually a person, but a algorithm or a robot that completes the survey and enters information. So it kind of spirals the number of gift cards out of control. But we put some, I guess, safety processes in place. You had to actually answer a skill question in order to be entered into the draw. So that definitely helped. We also had compensation for parents and youth time who participated in the focus groups as well. But the final survey, there was no incentives to complete that. So we're hopefully banking on the fact that they were invested and involved in the subject and wanted to see it through to the end. Yeah. And I just saw another question. Process guideline for a systematic environmental scan. What a question. There's currently no specific guidance on how to do an environmental scan specifically in health research. There are different methods and approaches depending on what discipline and domain you're working in. Also, I think it depends on what the end product you want to look at or the type of knowledge you're wanting to synthesize and collect. We specifically wanted to look at online resources that were available. So we did an environmental scan mainly through Google search engines just to see what online websites or resources were available. We didn't include apps or anything like that. So you could go search the App Store. We also didn't do any stakeholder or informant interviews, which is often sometimes a big component of environmental scans as well. But there is actually a systematic review that came out recently about the different environmental scan processes and procedures, and I can share that reference with you. And I know that there is a national group working towards creating a bit of a evidence-based guideline and reporting structure on how to do environmental scans. So hopefully that's helpful. Okay, we'll move on to the next section. Okay, so now you've heard about two slightly different priority setting projects in slightly different target populations as well. So Andrea's going to go into comparing and contrasting the priority topics themselves in a little bit, but I thought it'd just be interesting to chat for a few minutes about the different approaches that we took in light of our end goals, the setting we were working within, as well as the resource availability and our target audience. So as Andrea noted earlier, one of the goals of their work was to promote research at that specific site and develop research capacity with those researchers and healthcare providers there. So it made sense to do a rather contained, in-depth JLA partnership approach. Whereas I had big lofty goals and thought, right, let's survey all of Alberta. So it was a rather broad approach to recruitment and engagement in that respect. Additionally, we're quite interested to understand whether the priorities differed between parents and youth. Often parents are used as proxies in child health research, and their interests and priorities are different, or driven by different aspects and decision-making processes. So we really wanted to keep the groups separate so that we could come up with a full list of parent priority questions or topics, as well as a youth-specific list of priority questions and topics. And that was our end goal. We wanted these two lists and we wanted to keep it all separate. A huge draw to the JLA approach is that it is rather flexible, and more often you'll see people have used a modified JLA approach, and that's often due to the intense nature of the process. But I think it paves the way for really in-depth engagement through the use of a steering committee. And it also, I guess it helps have patients, healthcare providers, and researchers on equal footing throughout the process. So the priorities that are developed are a priority to all of those stakeholders and parties involved. Whereas we were so much more concerned with giving parents and youth a voice, and researchers and healthcare providers really had no input into the generating those priority topics. Additionally, we differed a little bit in our approaches in terms of we didn't so much want to create this list by knowing what was already answered out there. We just wanted to come up with these priorities to say, look, this is what's important. Now we can go and see what's been done in that space or what needs to be done to move it forward. Resources were also a big consideration when looking at what approach to take. And I think for both of us at times that was completely out of our control in terms of how the pandemic influenced things. But in hindsight, like moving things online actually allowed for more representation from those outside of those central catchment areas where they otherwise might not have had the opportunity to travel to participate in focus groups. Also, while I would have loved to have traveled around the countryside, promoting, recruiting, gathering data and hosting focus groups in different areas to get that larger catchment size, I think it actually worked in our favor being able to do it online because we could disseminate through different channels. We could reach different audiences that might not have engaged in in-person events or been able to travel to certain things. However, through Andrea's GLE approach, there was more of a need, I think, for in-person engagement to have that in-depth discussion and reach consensus on priority topics. So I think working with a smaller group at a specific location really benefited from that more in-person engagement that was done for most of her study. And now we've mentioned a few times that it's really important to involve parents in child health priority setting processes. But again, I just wanted to get youth voice at the table. However, that did come with challenges that I did not anticipate originally. We plan to recruit youth aged 10 to 14 as well to see if their priorities actually aligned with some of the older youth groups, which actually ended up being ages 15 to 24 that were included in the study. But due to different informed consent processes for online research, it proved quite difficult to get younger youth consenting into the study, as well as then getting their parents' assent for them to participate in the study. I just saw a question pop up in the chat. Running focus groups online over Zoom with youth is incredibly difficult. Sometimes youth aren't that engaging, and so running a focus group on a Saturday night with no one having their camera on was stressful and challenging at times, but it really allowed for excuse me, some really rich in-depth discussion that I don't think would have come out of in-person settings. As well, when you're engaging youth and parents, power dynamics can come into play when you are trying to do combined work. So it was really important for us to keep it separate and make sure youth had a space that they could voice their opinions. Okay, excuse me. Andrea, is there anything you wanted to add to the choice of your end users for the group?
I don't think so.
Okay, great. I'll turn it back to you, which is great because I'm losing my voice. Although I'll just say, like, there is definitely a right and wrong way to engage with stakeholders, but there's definitely a variety of ways and multiple ways of doing priority setting projects and practices. And if others are wanting to embark down this route, I would strongly suggest you consider some of these key points around end goals of the project, what setting, what resources you have available, and your choice of end users and how that impacts the end goal of the project. Cool. Now you get to do the fun stuff, Andrea, comparing the priorities.
And then, of course, after I say no, I'm going to say, yeah, maybe I do have something to add. I guess for us, engaging with youth was not really, we didn't really explore it that much to start with. For us, it focused on all children under 18. So to sort of parse out only a portion of that population and see what their priorities were, then didn't necessarily reflect sort of the whole population. And the clinic that we were at sees primarily infants, toddlers, young children. So to start focusing more on youth or, even young adults didn't quite fit. The ones who were able to more engage in the project, it just didn't quite fit for the clinic. So we'll move on. I'm just going to pull up my chat box too because I couldn't see it, I think, without changing the screen there. So here you can see all of the priority topics together on one screen. So the left side of your screen is the parent priority topics from Sarah's study. Down the middle is the youth priority topics, and then the caregiver and healthcare provider topics from our study at the Northeast Community Health Center are down the right side of your screen. So one thing that has come up with our study at the Northeast Health Center is the idea of generalizability, like how much can we take these topics and, extend them beyond this site? Are they considered, meaningful or relevant in other settings? As Sarah was doing her presentation, I realized I didn't present any demographics on ours, and it was actually something I was looking more into last night. That our representation that we ended up with is actually quite similar to the Canadian population. We didn't have all of the visible minorities represented, but the percentages of many of the groups were close to what they are in the 2016 census. So it's definitely something I'm going to reflect more on in our representation and the generalizability. But with the priority topics here, I'm going to start, if it will. Oh, it might just be slow. Oh, I might have to. I'm not sure now, Sarah. I've pressed too many buttons waiting for it to advance. There we go. Okay. So the highlighted one here is just pointing out the priority topics for youth and the priority topics for caregivers and healthcare providers. And that both of these priority topics highlight early mental health issues. So the recognition or prevention of mental health issues for children, youth, or families. Next, I would highlight the frequency and consistency, like Sarah had mentioned, of mental health issues. And that's broadly across all of the priority lists, which is pretty consistent with what other studies have shown as well. So parents, youth, and healthcare providers across both our studies consistently prioritize mental health topics. Next, I'll just highlight the ones that are related to screen time or social media. So again, these were present across all three priority lists. So looking at the impacts of screen time, parents in Sarah's study wanted to know, the impacts on children's neurodevelopment specifically. In our study, it was a very broad topic looking at the physical, social, and behavioral developmental impacts. And then social media for both youth and caregivers and healthcare providers, the impacts of the impacts of social media on children or youth's anxiety levels, and then on their health and well-being generally. And then I just wanted to point out, coming from Sarah's study, the priority topics that were unique to youth that didn't show up on either of the sort of adult generated priority lists. And so these were the effects of cannabis on youth's long-term health, accessing reliable sexual health information, and then how to respond to someone having a seizure. And then here I just highlight a couple of the unique parent identified priorities, again from Sarah's study that just that looked at ways to engage children in conversations about self-confidence, and then the early signs and symptoms of behavioral disorders in children. And then here I just wanted to highlight in Sarah's priority list, just sort of reflecting on the process differences that we did. And like Sarah said, their end goal was different than ours. When they're looking more at, knowledge synthesis or knowledge translation, and looking at what information or what questions do they have, and whether or not they're answered wasn't their priority. Whereas for us, it was more about addressing a primary research gap. So we remove the questions that were considered to be answered currently. So the questions that are highlighted are just ones that really would have been removed early on in our priority setting process. So these types of questions although they're not in our list, never really had the chance to be there because of the process that we took. And then just between the two studies, that mental health was really a top priority that was quite prominent throughout. Here you can see a number of the priority topics just listed all on one screen. So the early signs and symptoms, causes, strategies for prevention, and supports were all priority topics. And then screen time and social media was another one that was a common thread. So like I said, the impacts of both social media and the impacts of screen time. And then just looking more at generalizability for both of our studies, can they extend beyond the Northeast Health Center, beyond Alberta? And, comparing them to other priority setting agendas or processes that have happened, how consistent are they? So our study at the Northeast Health Center is listed here at the top at looking at children under the age of 18 and their parents and caregivers and healthcare providers, with the top priority being what are the best strategies for the prevention of mental health issues in children and families. And then Sarah's study with priority lists are listed there. So across Alberta, engaging parents and youth, and came up with 2 priority lists. And so the early signs and symptoms of anxiety and depression in youth, and then the effects of screen time on children's neurodevelopment. This next study by Brockway was done across Alberta as well, but was looking at children under the age of 2 years specifically, and this one was led out of Calgary. And their top priority was how can families be supported to develop coping strategies, emotional regulation, and resiliency in both parents and children. And then the Bialy study from 2018 was done through PERC, so the Pediatric Emergency Research Canada, which was out of children's emergency departments across Canada. And that one was considered patient and family informed. And mental health presentations was their top priority. So of course, emergency department is a different setting, but that mental health was their top priority as well, as something to be noted. And then the Levine study was quite similar to the one that we completed, but it was done in the Greater Toronto area with the Target Kids Research Network. And although it was 5 years ago, it was actually almost identical, the top priority question towers with what are the effective strategies for the screening and prevention of mental health problems. So just interesting to note that despite the differences in engagement strategies or, focus age groups, that mental health is quite consistently top of the list. And it really should speak volumes and highlight to researchers just how important mental health is for children, youth, families, and healthcare providers. And back to you, Sarah.
Great.
So Sarah's going to talk a little bit about using these priorities now that we've got them.
Yeah. I'll try and wrap it up fairly quickly so we do have more time for discussion and questions. So just a heads up that we are working on publishing this work. So Andrea's paper is currently under review. Ours is still pending submission. But we thought it'd be really good if we could get these papers published and out there so that others can use them as justification and cite them as to why the research that they're doing is a priority, if it's of that topic. But I think there's multiple ways others can use this work. So for example, I think it would be really great to work with research organization and funders such as Wickery and the Stollery and the Strategic Clinical Networks at Alberta Health Services to guide some of the funding calls or like set roadmaps for priority research areas across Alberta. These lists can also be used to guide knowledge synthesis activities. So as Andrea was talking about, you could look at what questions have already been answered. Also, we know that the best way to understand where the research gaps are is to do a synthesis of what's already available. So hopefully doing that work will help guide whether or not it needs to be a primary research activity to fill that gap, or perhaps it's more of a knowledge translation activity. to fill that gap. And what I mean by that is, well, I'll give the example of our parent priority topic, which was in excessive screen time on children's neurodevelopment. I was quite surprised that that came up as a priority topic because there is a lot of research out there about that. There are guidelines around the amount of screen time for use with children at different ages. So looking at the scoping review, we've sort of seen there's plenty of information out there, but it's obviously not getting to parents. So perhaps there's an opportunity to develop a knowledge translation strategy or product that provides some of the key answers and information to help parents guide the discussions they have around screen time with children, as well as help them make informed decisions around the amount of screen time their child has. So that's what I mean by whether is it a primary research project to fill a gap of something that's unknown, or is it more of a knowledge translation initiative that needs to be conducted? Regardless of either one, I think, we really hope that those on the call, hopefully child health researchers, research organization and funding bodies, use this information to really drive research that matters to those in Alberta. And that was sort of the big underlying effort behind this. We want to make sure that parents and youth across Alberta have a voice in the research that's done to hopefully improve health outcomes in the future. So plenty of time for questions, and we actually helped by we have some frequently asked questions that we get at conferences or when we talk to colleagues about this work. So if anyone has questions, feel free to ask, or discussion items. If not, we could talk a little bit about some of those frequently asked questions that we've received in the past, if that's of interest to anyone.
I think I just did something with the screen share, Sarah. Can you still see it? Okay, there we go. Sorry about that.
That's so good. We've got it now.
I can't pull the chat up on mine. I'm not sure what it does when I click on the chat, it does wonky things. So let me know if there's anything in there.
Mm-hmm. I guess I'll ask a question. Was anyone surprised by the research priority questions or topics that we found? Something that was on the list or wasn't on the list?
I put my hand up, but maybe you can't see it.
No, yeah, I'm not sure who's moderating question.
Sorry. I was a little surprised about the one in the youth priorities around epilepsy, or maybe it wasn't it's about seizures and whether or not there was any like context around that. It did seem to kind of be different from the others.
Yeah, that one definitely threw us for a bit of a loop as well. It's unfortunate I couldn't provide much context around like the focus group discussions. But it sort of stemmed from a discussion around youth. A lot of them were at university and kind of were quite concerned around brain health, like what if something happened to their brain? Like they're still young, they're still learning. And it kind of, this discussion just evolved around like, yeah, we wouldn't know what to do if there was an incident, and it's really important to be able to help someone. So it came from more of that lens, like wanting to help others and make sure that they're supporting people. It just, happened to evolve around seizures, which I thought was quite interesting as well. Again, we didn't, we did run 6 focus groups with youth. Looking at the data, we did reach saturation on a lot of the topics, but not all of them. But a caveat was that, again, during the pandemic, it was just hard to kind of keep people engaged and to run and facilitate these online focus groups. So perhaps if we had have done more, would that topic have come out as strong in the transcripts and the discussion or not? Yeah.
Okay, I'll ask another one. And it's maybe tied to your bullet point number 1 here around COVID. Like, at what sort of frequency would one typically kind of redo this kind of a process? Like, is there a shelf life? And, you know, and especially knowing that COVID had such a major impact on everyone's lives, like what would be the sort of recommended frequency to go back and do, because it's a huge exercise to pull this off, and certainly not something that you can be doing routinely.
No. I'll quickly answer, then pass it to Andrew to chime in. I would say there's no kind of set timeline on these things, but I've also often questioned if we did the priority setting process before the pandemic and then 2 years sort of afterwards, would the priorities have changed? Would some of the topics just become more of a priority? Like, I think mental health has been a huge priority for parents and youth for a number of years now. Did the pandemic exacerbate the need to channel and focus research in that area? I was laughing at the fact that vaccines kept on coming up. I was like, oh, is this a pandemic priority or a general priority? And it turned out it was separate to the pandemic, but it was interesting to know that that was a topic that came up. Yeah, I would love to redo this again if we had the resources and time now, and just compare and contrast the different priorities. But I think definitely if there's environmental changes or situational changes, it should be redone. But I don't think there's any, not that I know of, any guidance in terms of like the timelines as to when these priority setting sessions need to happen. Andrea, do you want to comment?
I haven't seen any guidance either on sort of frequency that they would recommend repeating it. One thing I did find interesting is when, because the one out of Toronto that I presented before, the Levine study, was done 5 years ago, which is the most distant one, that questions that were on there, there was one about screen time limits. You know, what is the recommended amount of screen time type of question. That one in our study was then removed because it has been answered. You know, there are guidelines on that now. So it's considered to be, you know, what is the recommended amount? There is guidance on that. So those types of questions, that some of them have been answered. And to me, that would be a lot of what you would look at first. I mean, some of them are, especially from our priority list, are more broad. So to look at them and say like, yep, that's answered, is not always the easiest, right?
Mm-hmm.
And then related to COVID, the thing I find, especially with our focus group being at the end, it was really whatever priorities they're looking at, if it really speaks to them personally, that's the ones that they really hone in on, right? If mental health or if socialization is becoming an issue for their child, or like our list, there was some ADHD, then, you know, they're more invested in that topic. And so a lot of that, I do think, just comes down to the stakeholders that you are actually engaging. And that is part of the JLA process, or any priority setting, is that it's always going to be subjective, and you could repeat it and it might not necessarily reflect, you know, sort of the times or COVID. It might just be the group that you're actually engaging with, not necessarily, it could be more, you know, there's always context around it. So they do state that outright within the JLA, right? And it makes sense that your priorities can always be different if you engage a different group, even within the same stakeholders.
A question's just come through the chat, Andrea. What are the potential biases involved in the participant selection process? Do you want to go first?
Okay, so that's one thing that I have reflected on. For us, we anticipated that there would have been more of a language barrier in clinic, and that of all the parents I approached, almost all of them agreed to participate. So language barrier came up a couple times where people were unable to participate. And then, you know, there's often time. And so that was the most common reason that people wouldn't participate, would be based on time, but it also could be something more than that, of it being me in clinic, who's approaching you. Definitely can make a difference if you want to participate in the study or not. For ours, I would say the biggest potential bias would come from that final priority setting workshop. Within the JLA, I think that there is a little bit of an inherent bias that you're grabbing a select group of stakeholders to engage in that final priority setting workshop. And even like Sarah, I'm not sure if you feel the same way. Like ours was only 12 stakeholders, or sorry, 15 stakeholders that engaged at the end. But you're getting the final list produced by a select group, and the JLA says anywhere between 12 and 30. And for us, it was just availability and who was able to make it. So you're getting people who are able to come, during their lunch hour, or if it's in person, even if it's not virtual, you're getting the ones that are able to be there, and you can do your best to remove those barriers, but there are always going to be ones that exist. And then people that just don't feel comfortable participating, that just always decline will always decline the opportunity to participate. And you're losing their voice in it, and you don't really know who's being lost in that.
Originally, one way we tried to mitigate any of the potential biases as best we could with the participant selection was, well, we engage the youth groups and the parent advisory groups. And in those groups, we do try and get a broad representation of different groups to understand what strategies would work best to engage with the communities. I was really hoping to push for in-person recruitment and engagement to really try and connect with some of the communities whose voices are often underrepresented in research. As Andrea said, often you do get those interested in research and wanting to have a say kind of come to the table for these sorts of projects. I think especially during the pandemic, often like the focus groups were amazing experience. We got some really rich data, but often I found it was a way that people could connect with other people going through the same thing. So it was a really interesting process. But yeah, you do get a select, I guess, participants with a select agenda coming to these projects sometimes. Yeah, I think if we could have done it again, would we have tried to reach different groups in the recruitment process? Definitely. Again, because it was all online, we were restricted to those that had internet access, that felt comfortable engaging online. And as well, we didn't have the means or the processes to work with participants with different languages. So everything was in English. So again, that restricted the participation from groups whose English wasn't their first language. That's a good question. I'm just trying to see if anyone else has got their hand up or writing a comment in the chat box. Thanks, Carrie. If anyone has any questions more specific to the individual parties themselves, like please feel to reach out to Andrew and I. Like, we really want this work to be used. So if you're an early career researcher or a research funder sort of thinking how to map out the next research project or agenda, like I think there's definitely a conversation we can have to help guide you in understanding the processes and next steps for using these priority lists.
Well, if there's no more questions, I would like to thank everyone for joining us today. And a special thank you to Andrea and Sarah for your talk and all of the important work that you two are doing. Again, feel free to reach out to their contact information, and I hope that everybody has a great rest of the day.
Awesome. Thanks, everyone.
Thanks,
it was really
everyone.
great to be able to present.
Thanks, everyone. Matt
Thanks.
must be, oh no, there he goes.
Yeah.
Well, thanks, Sarah. I think that went all right.
Yeah, I think that went quite well. Some good questions in there for the different processes, which I thought were really helpful. Hopefully people reach out or use what we've found. I don't know if I plugged that enough.
Yeah, I don't know. I mean, it is what it is. I don't know. And even just to get even if it's just a few, right? It's like any is better than nothing. So that's good.
Yeah, definitely. It's out
Yeah.
there.
Yeah.
So thanks, Raman.
No problem.
Yes,
went
thank
well.
you.
Yeah, tech, perfect. It's cool.
That's control sharing thing is neat. Yeah. It's just when I screwed that up a couple times where it was like, oh, there's like a chat thing, and then I would press it, and then it's like I just switched the slide, and you were like, oh, it's jumping ahead. I'm like, ooh,
It was you.
yeah, that's me. I won't touch. I'm sorry.
All good. Okay, cool. Thank you so much.
Yeah. Okay, thanks.
Yeah.
Enjoy
Bye.
your day.
Have a
Okay,
good
see
day.
you. Thanks, Raman.
Yeah, thanks, Raman.